long arm, strong arm. It's got to be expendable, synergistic, and preferably horizontal. You want it to act in a straight line. Again, that's a good part of the transferring too. Then, so if we just think about that, he had a wrist drop, so we needed to give him some wrist extension, thumb extension, finger extension. So we had to check that the tendons we were transferring were expendable, and that he did have other tendons that would make up for that as well, and that they were working because he had a bite. So we took his pronator teres to make that a wrist extender. We took his flexor carpi radialis to become a finger extensor. He did have an FCU and it was functioning. Otherwise, he drifted out to extension. And a palmaris transfer his palmaris to his thumb, which is a pretty standard radial tendon transfer. Respect to where you're transferring to, and those were
subcutaneous transfer and a safe transfer, so not through infection or scar tissue.
Yeah, so good soft tissue there. So he doesn't fulfill all the criteria of a tendon transfer. So we're struggling here because he's got a dislocated radial head. He's got a very abnormal wrist with limited range of motion in his wrist. So, and he had a scarring there, which was right in the line where we wanted to do our thumb extension. So we made a junction here rather than underneath that scarring. Also, we're worried that he's going to stretch out. So I want to increase his wrist dorsiflexion in the splint today, so we'll hold him dorsiflexion a bit more. So, but yeah, we'll sort that out.
So then the other two things that start with general infection patterns, suitable age, so over 4 years old generally. Under 30 has the better results because no maximum and sensible patient. So someone who perhaps has a very following structure is
and experience of the operator again. So there are general factors that are general. You're going to have the adequate physiotherapy afterwards and so on. So it is vital that we communicate with the therapist as to what our surgical problems were. So at home, I print 5 copies of an operation report if they need a hand therapist. One's for me to send to the GP, 2 are for the hospital, 1 is for the patient, and 1 is for the physio. And that's the physio referral. It's the operation report. If you do a good operation report, you don't have to write it again. I don't like doing things twice. So communicate with the therapist and say, hey, we've got some problems here. This was a stiff wrist and not a great soft tissue bed just there. So we're going to modify the way we do things. So talk to the therapist, and then the therapist will talk to the local therapist here and give them a very clear line of instruction. There's no point putting him through a big operation and not getting the therapy right.